I'm Dr. Dan Sumko. I'm a hip and knee replacement specialist. I was raised in Brigham City, Utah. After graduating high school, I attended Dixie State University, where I played football and prepared for medical school. I went to medical school at the University of North Texas Health Science Center and residency at the UPMC Pinnacle Health program. After completing my residency, I decided to do an additional year of subspecialty training or a fellowship in hip and knee replacement at the Core Institute in Phoenix. Opportunities to practice in this area are very few and far between, so my wife and I feel extremely fortunate to be able to come back and work in this area where we're both from and be close to family and be a part of this great community. My fellowship training allowed me to get extra experience in computer navigated and robotic total hip and knee replacements, as well as exposure to revision hip and knee replacements, or having to redo a hip or knee that's already been replaced before. I also have training in muscle sparing techniques that allow a more rapid recovery. My patient philosophy is rooted in what's called shared decision making, where a patient is fully informed of all their options and then the pros and cons of each of those options, and they're able to make a choice. So when I bring a patient into the office, I pull up their x-rays, I show them what I see on the x-rays and explain what that means, and then I explain all their options to them and the pros and cons of each of those options, and we make a decision together. I don't ever want anyone to feel like they've been forced into a surgery or forced into getting an injection, but instead it's a decision that's informed and that we make together. Some of the best data right now that looks at unsatisfied hip or knee replacements tells us that the root of the problem is really in poorly managed expectations, meaning the patient didn't fully know what to expect or what they were getting into or what all their options were. And so I think this shared decision-making process really helps eliminate or minimize that problem of people being unhappy after their joint replacement, as we discuss things together and make an informed decision together that we're both really happy with. One of my favorite patient interactions so far has been replacing a hip on a woman who was in her early 50s. She came to me and was concerned because she was obviously so young for a hip replacement, but she was severely debilitated by her pain and unable to do the things that she really wanted to do. I really took a lot of time with her talking about expectations and how things would be afterwards and the level of function that she would have, and she decided to go forward with the hip replacement. We were fortunate enough to be able to do her surgery through the direct anterior approach, which is a muscle sparing approach that the literature tells us allows for a more rapid and less painful recovery. I personally like the anterior hip approach because I feel like it allows me to better size and place my total hip components, and then also more naturally and accurately restore the leg lengths and offset for the patient so they have a more natural feeling hip replacement. She recovered very well and did well for the first few weeks, and then it was really satisfying to get a text message from her husband a short while later, which was a picture of her standing at the top of one of their favorite peaks in Hawaii that previously she wasn't able to summit because of her hip pain. Now she was there standing at the top of this peak and living her life again. And it was a nice, rewarding experience and a good reminder of why I went into this field and why really we do joint replacements: to eliminate pain, to restore activity and function and motion, and get you back to doing what you really want to be able to do.